You were telling me about the operation earlier, but I just want to pick up on one or two things. So, about 8 weeks after the cancer, you had the operation.
That's correct.
But the operation was obviously a major operation involving how many hours, did you say?
Altogether 12 hours.
And how many surgeons?
3 different consultants.
All in the room together?
All in the room, plus obviously their individual backup teams.
Yeah.
And also they filmed the operation as well.
Really?
So there was somebody in there filming it.
For an educational
For an
purpose.
education thing, yeah, because obviously that might be relevant in years to come.
And tell me the story you told me about how they decided where to go.
Oh, well, what it was, because there was urologists involved, plastic surgeon involved, a cancer specialist involved. I see my urologist at the Leicester General, but I see Mr. Offer at the Leicester Royal, and there was like a battle going on between them. Where should this be done? Should it be done at the General? Should it be done at the Royal? And they was both trying to get me to come down on one side or the other. And in the end, I just said, look, I'm not really bothered. You do it in my shed, just get it done with. And eventually Mr. Offer won it. It was done at the Leicester Royal.
So you said, you can do it in my garden shed if you want.
Yeah,
as long as you
just do it.
And did you know how good the result would be, or was it just an uncertain thing for you?
No. I mean, to be fair, all 3 consultants did explain that there was no guarantees. And if it didn't work, they would have to go back to square one and remove the penis.
Yeah.
And I went in knowing that. I went into that with my eyes open.
Yeah.
But there was that chance there. And I think if there's the chances there, then grab it with both hands. Because at the end of the day, I knew then that whatever happened, I wasn't going to lose my life through this.
Yes.
Whatever they had to take away, they had to take away.
Yeah.
And life is far, far more important.
Can I just see if I interpret you correctly? Because there'll be some people on this watching this video who haven't had the benefit of that very new operation, who maybe had to have the removal of the penis in their case. If I'm understanding you correctly, you're saying that it's still important to strive for the ultimate outcome, to prolong your good quality of life.
It's all about quality of life, survival, and not only for yourself, for your friends and family.
But by the same token, you don't necessarily, everybody would be afraid of losing, the penis if it was threatened. I think what you're saying, if I'm interpreting you correctly, is that you were prepared for it.
I was prepared for it, yeah. I mean, at first, of course, it's a shock. It's bound to be a shock, and it has an effect on you.
Yes.
But then you've got to try and see things in black and white, which is more important. And your life is far, far more important, and to those around you.
If it had come to that, did they discuss any options for you, like, for example, different types of plastic surgery or implants, prostheses, and all things like that?
Yeah, that was all discussed with me, but obviously that road wasn't gone down, didn't go down that road too far, because we wouldn't have really progressed on that if things hadn't worked out as they had.
I see.
But they did explain that side of it to me.
Yeah.
And my urologist also explained that if necessary, so you and your wife could even have some form of sex education.
Yes.
To get over the relationship side. He said, yes. Because there's always things that can be done.
In other words, there's planning for each eventuality.
Exactly. Yeah, there's always a plan in place.
Okay, but in fact, it turns out that you had this cutting-edge procedure, and obviously it was highly successful from your point of view. Were there any other hidden either benefits or hidden hazards which you weren't aware of but had to face later? For example, I'm thinking of your weight or diet or other things, anything.
I think weight loss was always an issue with me because I'm quite a small person anyway.
Yeah.
And like any weight loss for myself has quite a dramatic effect. But I was lucky enough that when I came home from hospital, a dietitian got involved, which was all organised by the hospital, and just put on a high protein diet.
Yes.
Which at first, I must admit, I didn't feel like eating. I didn't want to eat. But eventually you get there, and almost got my weight back to normal now. Still a little bit off, but almost there now. And it's a case now of little and often. So in a way, you change your eating habits a little bit, but you get there in the end.
So what amount of weight did you lose?
Well, normally my weight is just over 9 stone, and my lowest weight was 5 stone 2. I went down to, so I just looked awful. I looked like a skeleton.
Really?
Absolutely awful.
That is very light. I mean, I know you're, what height are you?
I'm only 5'2".
Yeah, but still 5 stone is really.
Yeah, I looked awful, absolutely awful.
And then you put that back?
Yeah, I've almost got it back now. I'm just coming up to 8 stone now, so almost there.
What do you think the reason for the weight loss was?
I think, crikey, there's a number of things involved. I think it's feeling physically ill. I think it's a mental thing. All sorts of it. The tiredness, I felt so tired because the cancer had progressed.
Yeah.
Pain. Lots of things was involved in it.
Yes.
Lots of things.
A combination of factors.
And they all sort of add up together.
And now, what's your appetite like?
Really quite good. Yeah, quite good. I wouldn't say it's 100% back to normal, but I'd say we're 80% there. And yeah, it's quite good now.
How long are we after the operation now?
Now we're looking at, 8 weeks down the line.
So quite recent.
Yeah.
8 weeks on.
Yeah.
How far back to normal are you now?
I'm back at work now, even though it's only part-time. I only do 3 days a week, but that helps me. And it's like getting out of the house, seeing other people. No disrespect, seeing different people apart from the family. Taking your mind off it. Because as I was speaking about earlier, it's always at the back of your mind. Is it ever going to come back?
Yes.
And I don't suppose that'll ever go away.
There's that fear, isn't there, in the background? And sometimes that's helped by some medical information. What do they say
that's
about
right, yeah.
staging and outlook?
Yeah, I mean, I'm still very lucky. I mean, both the Leicester General and Leicester Royal are both keeping an eye on me. My urologist is, my cancer specialist is. I'm still having scans. And so far, so good.
Yeah. What have they said about your outlook? That's the prognosis of the cancer.
It's looking very good at the moment. Very, very good.
Yeah.
And obviously, while they keep looking after me, then I'll keep going on.
Yes.
Yeah.